Bismillahirrahmanirrahim. Today we will discuss about the various diarrheal diseases, and there are different mechanisms for the occurrence of diarrhea. So there may be defective intraluminal digestion, that is, digestion of fats and proteins may be defective, and this may be due to pancreatic insufficiency owing to pancreatitis or cystic fibrosis. Then there may be Zollinger-Ellison syndrome with inactivation of pancreatic enzymes by excess gastric acid secretion. Then solubilization of fat owing to defective bile secretion. Or there may be ileal dysfunction or resection with decreased bile salt uptake. There may be cessation of bile flow from obstruction, that is, there may be hepatic dysfunction, and nutrient pre-absorption or modification by bacterial overgrowth. Then there may be primary mucosal cell abnormalities. This is the second mechanism of diarrhea occurrence, primary mucosal cell abnormalities. So there is defective terminal digestion that may be due to disaccharide deficiency, that is lactose intolerance, or bacterial overgrowth with brush puddle damage. Then defective epithelial transport, that may be due to A beta lipoproteinemia, primary bile acid malabsorption due to mutations in the ileal bile acid transporter. And the third mechanism may be there will be reduced small intestinal surface area. And this occurs in gluten sensitive enteropathy, which is also called celiac disease, gluten sensitive enteropathy. Or it may be due to Crohn's disease. Then there may be lymphatic obstruction, and that may be due to lymphoma, which leads to lymph node enlargement, or it may be due to tuberculosis, that is tuberculous lymphadenitis. So then there are various types of infections, that is acute infectious enteritis and parasitic infestation, tropical sprue, and Whipple's disease. Then there may be sometimes iatrogenic diarrhea may be caused by certain procedures, that is subtotal or total gastrectomy, short gut syndrome following extensive surgical resection, and distal ileal resection or bypass. So these are the different mechanisms in which there may be diarrhea. So to summarize, so first is defective intraluminal digestion. Second is primary mucosal cell abnormalities. Then is reduced small intestinal surface area. Then lymphatic obstruction, infections, iatrogenic. So there is a long list of diseases which can lead to diarrheal disease, but we will only discuss few of them in detail, especially which are important from examination of point of view or clinical importance. So that is the celiac disease. So celiac disease is also called gluten sensitive enteropathy. So this may be seen in children as well as in adults. Gluten sensitive enteropathy. So gluten is a cereal, and it contains gliadin, which is the culprit in this disease. Gliadin is the major component which produces celiac disease. So it is an immune-mediated enteropathy triggered by ingestion of gluten-containing cereals such as wheat, rye, or barley in genetically predisposed individuals. And celiac disease is an intestinal immune reaction to the gluten. And gluten is digested by luminal and brush border enzymes into amino acids and peptides. And one amino acid is gliadin peptide that is resistant to degradation by gastric proteases. And gliadin is degraded by, deaminated by tissue transglutaminase, and it interacts with HLA-DQ2 or HLA-DQ8 on the antigen presenting cells. And then it is presented to the CD4 positive T cells. And these T cells, they produce cytokines which lead to tissue damage and characteristic mucosal microscopy. And there is also formation of autoantibodies, antibodies against the tissue transglutaminase, antibody against gliadin, that is anti-gliadin, and anti-endomysial antibodies. And these three antibodies, they are important in diagnosis of celiac disease. The epithelial cells, they express interleukin-15 that leads to proliferation of CD8 positive T lymphocytes. So morphology of celiac disease, microscopic appearance is a characteristic. Often the second part of duodenum is the place of choice for taking biopsy, endoscopic biopsy. And sometimes proximal jejunum, which are exposed to the highest concentrations of the dietary gluten. And there is increased intraepithelial lymphocytosis and crypt hyperplasia. The villus or villi, they are atrophic, and there is increased number of plasma cells, mast cells, eosinophils in the lamina propria. So there are 4 microscopic features: intraepithelial lymphocytosis, that is increased number of intraepithelial lymphocytes, and this number is graded according to a specific criteria, that is Marsh criteria. Crypt hyperplasia, villus atrophy, and increased number of plasma cells, mast cells, and eosinophils. So this diagram shows the celiac disease microscopy appearance. This is the normal appearance. Here you can see the normal length of the villi of the duodenum. And here you see flattening of the villus. There is loss of villi or villus atrophy. And then crypt hyperplasia. So the crypts, they are hyperplastic and elongated, and there is increased intraepithelial lymphocytes. So these are the intraepithelial lymphocytes, which are increased in number. And the lamina propria contains plasma cells and lymphocytes. They are sometimes eosinophils. So this is the characteristic appearance of celiac disease or gluten-sensitive enteropathy. Then there are certain terms which are sometimes used in celiac disease, that is silent celiac disease. Silent celiac disease is when there is positive serology and villus atrophy but without symptoms. There are no symptoms, but patient is positive for antibodies, that is anti-tissue transglutaminase, anti-gliadin antibody, and anti-endomysial antibodies. And there is villus atrophy, but no symptoms. That is silent celiac disease. Then there is a latent celiac disease. In this, there is positive serology, but no villus atrophy, and latent celiac disease. So antibodies in the celiac disease, as I said, there are anti-gliadin antibodies, anti-endomysial antibodies, and anti-tissue transglutaminase antibodies. So diagnosis of celiac disease is based on clinical symptoms, signs, and then serologic diagnosis, that is presence of antibodies, and biopsy of the duodenum. So the diagnosis depends on three features, that is symptomatology, biopsy findings, and serology. So what are the complications of celiac disease? Celiac disease patients, they are more likely to develop a lymphoma, which is called enteropathy associated T cell lymphoma. This is very aggressive lymphoma, enteropathy associated T cell lymphoma. And second complication is adenocarcinoma of small intestine. This is also more common in patients with celiac disease. And the third complication is malabsorption. These patients, they are often anemic, or they may show deficiencies of various vitamins or other minerals. So these are the complications, that is enteropathy associated T cell lymphoma, adenocarcinoma, and malabsorption. So that is about celiac disease.